Thank you, everyone. It's wonderful to be here. 26 months ago, our people and nation were changed forever. And on that day, as you saw in the video, our organization was formed. And it was formed with a very specific mission: to protect and save as many Israeli lives as possible. The crisis impact we have had over these past 26 months has been tremendous, and much thanks to this community and communities across North America. We've been able to provide over $50 million of aid. We were born on October 7th, and we have brought over 500 tons of support to the people of Israel, mainly our defenders. Now, our two key focuses are how can we provide innovative solutions in the space of defense and the space of healthcare, of mental health, to protect our people where there are gaps in the system. And in that, it has meant providing over 40,000 hours of immediate access to psychiatric support, as well as over 10,000 drones, camera systems, and other technology solutions to our soldiers, whether they're in the tunnels or above the ground, wherever they may be. Now today, I'm here to speak about the two battlefields that we are experiencing today. We have spent 2 years in the field with mental health professionals, soldiers, first responders, and civilian guards. And what we see is that the battlefields of the future are that our people's mental health and our community's domestic security. When we speak about mental health, we see stuff in articles and online, but what I have here today is the most up-to-date numbers we could put together across the government and non-government agencies. The numbers are hard, so please bear with me. These are recent numbers from this past quarter. 15% of Israelis are experiencing significant mental health duress. 500,000 Israelis are experiencing PTSD, and 1 million Israelis are experiencing significant levels of anxiety and depression. These 1.5 million people, their mental health duress is impacting their day-to-day lives, and these numbers are going up. Now, in the best case scenario, we would have 1,000 patients for one psychiatrist in Israel. So it doesn't take a rocket scientist to realize that we have breakage in the system, that something is wrong and something must be done. So we sat as a team 25 months ago and said, how can we have an impact here? How can we bring an innovation to the Israeli healthcare system? And what we came up with was a telehealth platform that would provide immediate access to psychiatrists. Today, if you go to one of the 4 HMO providers in Israel, it will take you 6 or 7 months to see a psychiatrist. What does that look like? You just got out of Gaza or Lebanon, your spouse just got home, your parent just got out of reserves. If you ask for help today in December, you will not see someone until June or July. Our platform is seeing individuals in 3 days. In 3 days, we are providing access to psychiatrists. Now, this isn't alone. We have phenomenal partners that we've built over the war across the Ministry of Health, the resilience centers in the South and the North, and recently we signed partnership agreements with both Maccabi Health and Clalit Health. And the results have been very meaningful. We've been able to treat over 8,500 Israelis nationwide and provide them immediate access to psychiatrists. And in that, we have figures, we have proprietary data of what Israelis are experiencing. And you are the first audience to see it, and we're going back to Israel over the coming weeks and discussing it with the Ministry of Health and others for what we must do to protect our people. First is that 83% of people require medication. That means from all of the people being referred to psychiatrists, only 17% have minor levels of anxiety, depression, and PTSD. This is a tremendous number, not one understood by the Israeli healthcare system ever before. What's scarier is that of the 100%, of the 8,500 individuals, 30% require 3 medications a day or more, from 3 to 7 medications a day. This is the reality we're facing. The second harsh truth of our numbers is who needs care. 60% of the individuals we are speaking with are 18 to 45 years old. They are the young. They are the parents. They are the workforce. They are those who are building our country. And the truth, the scary truth, is that this isn't getting better. The numbers are going up. So the reason I came today and the reason I fly around the world in North America, one of the key reasons is to discuss this battlefield, because very often we see it as a silent epidemic. The country is being crushed by PTSD, depression, and anxiety, but too often we are not discussing it openly. As well, the numbers are going up. So if someone thought this was getting better, it's not. The fact is that month over month, we're treating patients in 3 days. So every month we have a new pool of individuals. Month over month, the request for psychiatric care is going up, not down. Because as the stress levels go up and down, people start to come forwards. We must fight this battlefield. The second space that we've been operating in for the last 2 years, as we saw, we've provided hundreds of thousands of pieces of equipment to our defenders around the country, is around domestic security. On 10/7, most of us learned what a civilian guard is. Most of us didn't know what a civilian guard was before. But we saw communities that were saved, and we saw communities that were annihilated. And the biggest difference was if their civilian card was activated on time. And what we're seeing today is that some of those lessons that we discussed in 2023 and 2024, they're already being forgotten. The fact is, these are our borders that we discuss. The Gaza envelope, which has tens of thousands of soldiers and now a perimeter, right, a gap. The northern border, which also has a buffer zone and tens of thousands of soldiers. Judea and Samaria, which is volatile, but it has had 30 years of civilian guard buildup since Oslo, as well as significant army presence. And then what we've heard recently on TV, the Jordanian and Egyptian borders with smuggling, which we all know crime today can lead to terror tomorrow, as we saw 26 months ago. The scary part of this map is the most dangerous borders not being discussed, right in the center of the country. Left or west of Judea and Samaria in central Israel, over the 1949 armistice line, what you see is a volatile environment that people are not talking about. This is where I went with my senior team just a month ago. We went to the Lev Sharon municipality. We went to Nitzanei Oz, you can see down there. And right there, we were looking out on their camera systems, looking over Highway 6. Every single one of you has driven on Highway 6. Even the UN says that's Israel, regardless of where they're mistaken elsewhere. Everyone in the world says this is Israel, Highway 6. And the scary part is there's an 8 to 10 foot fence that you can simply jump over and you're on Highway 6. In 3 minutes, you're in Nitzanei Oz. 3-minute walk and a 25-minute drive from Netanya, where there's 250,000 Israelis living. If someone wants to think that this is not a risk, then just think how we were thinking 26, 27 months ago and the years before that. This is a critical risk that needs to be discussed. Now, is it really a risk or not? And the truth is it is, because I sat with the civilian guard team and I asked, is this real or not? And they said that 25 to 100 individuals jump the fence. Not every year, not every month, not every week. Every day, there is 25 to 100 individuals who jump the border and go work in Israel. What is work today, what are networks today to cross that border, are terror networks in the future. Now, we work with the civilian guard teams, and this is where we hope everyone here will find ways to be involved, whether it's with our organization or others, is that there's real-time surveillance systems that are needed, cameras, sensors that give advanced warning, and that is what saved communities on 10/7, and that is where there is a massive gap in central Israel. And when you're driving on Highway 6, you want to know that you're safe. And when you're sitting in Netanya, you want to know that the first line of defense is well situated. The last is providing the equipment and training they need. Today, these individuals receive 4 training days a year, and we're working to increase that with the government and as a nonprofit. So we firmly believe it is our responsibility to protect our people and communities, to attack the silent epidemic that is crushing our country, and to defend our communities with preventative and secure systems. Thank you.